Good afternoon, colleagues, and thank you, Professor Keterere and the PharmaConnect team for inviting me to this important webinar. We have heard the experiences of some call survivors, some call them recoverers, but the stories were so profound and very touching. And it shows that surviving or recovering from COVID is quite a long and an easy journey, and people still have some lingering effects despite having recovered from the COVID-19. So what I'm going to share with you is not about the experiences, it's about what TUT at TUT we are doing to ensure that those that are afflicted with COVID eventually become survivors or eventually recover from COVID so that they can also share a similar testimony as what we have heard this afternoon. What I'm going to share with you is about case management. Case management is a process whereby it allows for an exchange of information with a person who has contracted COVID-19, and it offers an opportunity for that person to ask questions and to have those questions answered. And it also provides an opportunity for referral and also provide other support and resources when necessary. Also, it's about developing trust and a warm and empathic rapport with those that are affected, while at the same time maintaining a professional relationship, which is the key to effective support. It is also a key in collecting accurate information to inform the next step in the contact tracing and investigation. So the main purpose of COVID case management, in some cases, you'll find that people go to do the test, but they didn't receive the results and they only learn about the results from a case manager. Or in some cases, the person has already received the results and the case manager will contact the person just to verify if the person is aware that they've tested positive to COVID. And it is also to provide disease-specific information and guidance in terms of how to manage the signs and symptoms of COVID. And at the same time, as a case manager, you do case management to develop a sense of the baseline of the medical condition of the person by the time the person finds out that they've just tested positive. And also to determine if there are other underlying conditions, and also to determine the risk that might lead to disease complication or delayed recovery. And we also do case management to assist in contact tracing, because contact tracing is also important because we try to prevent cluster outbreak by doing contact tracing. And also to gather information for continued monitoring and support to those that have contracted the disease. Now, who are case managers? Within the context of our university, case managers are health professionals who manage COVID-19 cases and contacts, and they manage them within their scope of practice. Those are our nurses, doctors, psychologists, counselors, and social workers. And then how do they get informed about COVID cases? They get informed in various ways. Sometimes they get information from the patient, letting the case manager know that they've tested positive to COVID. Sometimes it could be from a family or a relative, because the patient is in a state whereby he cannot communicate, maybe either being hospitalized or being in high care or ICU. Sometimes we get informed by the lecturers or the supervisors or the employer. Sometimes the colleagues themselves, they'll share information because they relate well to each other. They will share information, and one colleague will also share the information that one of the staff members has tested positive to COVID. Again, we get information from the district health services, whereby they will inform. We have a good relationship with our district health services, whereby once they identify that a staff member or a student who is from TUT has contracted COVID, they will inform us as case managers so that we manage the case. And then once we are informed about the case, the person who is reporting the case will gather the information from the person who is being afflicted with COVID, and then we'll fill in a case notification form with the following details: the personal details, suspected date of infection, place where the infection might have happened. We want to determine whether the infection happened on campus or outside campus, of which in most cases, up to so far, we have realized that most infections happen during social gatherings, especially outside campus. And we also want to determine the date of the initial symptoms, which is very important for us. When did the initial symptoms happen? And the signs and symptoms experience. The reason why we gather the signs and symptoms is for us just to have a sense of the common signs and symptoms that most people experience, of which by now we know that it's the common one is fever, the dry cough, loss of smell, loss of taste, lethargy, and sore throat. Those are the common ones that we realized so far. And then again, we need to determine when last was this person on campus prior to receiving the result. And why we need to know that, we want to identify those areas where the staff member or the student have been, so that we try to prohibit people from entering those areas until they get decontaminated. And again, the same areas visited on campus, I've mentioned that. And then once the case manager receives that information, he will start contacting the person, the person that has COVID. And then he will have an interview with that person. It's very important for the case manager to introduce herself and explain the reason why he's contacting the person, and then gather the personal information. At the same time, when you gather the personal information, you are trying to verify if you are talking to the right person. It's very important, again, to establish a rapport, just build that relationship so that the patient feels comfortable to talk with you as a case manager. And it's very important to ensure privacy and confidentiality so that the person can be able to be open and free to discuss whatever that they want to discuss with you. And as health professionals, it's very important to keep a record of every case that you manage, records of interview, and also record in the case register for statistics purposes. Again, you have to develop a communication plan. It's not only a communication plan, but a case management plan in terms of how are you going to manage the case together with the patient, looking into the situation of each individual. Communication plan also helps you in terms of agreeing with the patient when and how are you going to monitor the patient and what information are you going to communicate and when. The interview also assists you to assess for the symptoms, which will assist you to obtain the baseline condition of the patient whilst he's being diagnosed, and also to determine if the patient has other comorbidities like diabetes, hypertension, and also encourage the patient to take medication regularly and adhere, which is very important, and also other risk factors like I've mentioned earlier. Very important, again, is to assess if the patient understands the COVID-19 diagnosis and what it entails and what is expected of him in order for him to recover and in order for him not to infect others. Pardon me for using the gender here as a him, but it could be him or her. And also provide coaching on disclosure. It's very important because we all know that there's a stigma attached to COVID-19. So it's very important to coach the patient on the issue of disclosure, because the family members have to know that the person that they're sitting with in the house has COVID, and also those that she or he has been in contact with need to know that someone that they have been in contact with has COVID. So we also coach the patient on the importance of disclosure. Now, managing COVID at home. If the patient is experiencing severe symptoms, that is difficulty in breathing, chest pains, or confusion, we'll advise the patient to seek medical help. With regard to our students at 2UT, we have a contract with an emergency medical service provider, whom when we find out that the patient has difficulty in breathing, will summon that EMS to go to the patient either at home, being it anywhere in South Africa, that EMS will able to get that patient to the medical center. Depending on whether the patient has a medical aid or not, he will be taken to a private facility or a government facility. And for those who are asymptomatic or experiencing mild to moderate symptoms, we explain the importance of self-isolation. Firstly, we need to assess the ability of self-isolation. Will the patient be able to self-isolate at home, at the residence? If not, then we determine the need to isolate the person at the government facility. If the patient opts to isolate at home, we have to determine the type of facility that the patient will be isolated at. We need to determine whether it's a single room, it's an apartment, it's a house, how many rooms are there communal areas that are being shared by other family members, how many family members are at home, and do they have comorbidities, and also assess what support and resources the patient might need whilst at home. With regard to our students, it's very important for us to determine if their family members know that they have COVID before we send them home, because in most cases, they will hide the information from their family members. So what we'll normally do, with their permission, we will ask them to give us the contacts of their parents so that we let the parents know that they have contracted COVID and they will be coming home to isolate at home under these conditions. And then if the parents agree, then we can send them home. But in a few cases, we found that the parents say, no, I have comorbidities, I cannot take care of my child, please make arrangements for her or him. Then we make arrangement that the student be taken to a government isolation facility. Again, whilst in isolation, if the person opts to isolate at home, we emphasize the infection control measures. They've been mentioned before. I'm not going to re-emphasize again on them, like limiting interactions and other stuff of wearing of masks, and then disinfecting frequently touched surfaces or shared utensils, and also identifying the other people who can help you with daily life. I've heard that Dr. Katsanda mentioned that he used to go to the malls or to the chemist to get some consumables. However, it is important that once you know you have COVID, you have contact with other people that can assist you so that you limit your movement to where more people are congregating. So it is very important to have a friend or a family member who can assist you with daily life activities like going to get groceries on your behalf. And also provide information to access medical services should a need arise. And we also emphasize the symptoms monitoring. What we'll normally do when we do our case management, we will call our patients after every 2 days to monitor the symptoms, if they're not getting worse or are they getting better, so that if they're getting worse, we realize that on time and we are able to respond on time to call an EMS to assist. So symptom monitoring is very important in cases where people have mild symptoms. Now, what we have done with the Department of Pharmaceutical Science led by Professor Keterere, we have developed a self-care tool to assist people to manage COVID-19 at home. And this tool is being informed by the CDC and the national guidelines, and again by the frequently asked questions from the people who have contracted COVID. So this tool covers the following aspects: learning about COVID-19. We give a brief background of what COVID-19 is, what the symptoms are, and again, we give information on the difference between quarantine and isolation and what quarantine entails, what isolation entails. And also provide information on the safety and hygiene practices that I've mentioned earlier and some of the speakers have mentioned. We provide them with that kind of information. And again, how to take care of oneself, keeping healthy and managing symptoms whilst at home. And the tools also covers how to identify in time and managing emergencies. Yes, we've heard from the previous speakers that COVID-19 comes with a lot of fear, anxiety, and stress. We also give tips on how to cope with anxieties and stress whilst in isolation. And again, when is it the right time to end quarantine or isolation? Also providing you with the contact numbers for support and information when needed. So this tool is going to be, we're going to use some graphics and pictorial so that it is more user-friendly. and it will be translated in 11 languages so that people across the country can access this kind of a tool to assist them when they're in isolation. Again, as I've mentioned earlier, when we do case management, one of the objectives is to do contact tracing, because the one who has the COVID-19 is the one who's able to tell us where he was and with whom. And we try to gather that kind of information from the person. And once the contacts have been identified, obviously we will determine close contacts. Those contacts are those that were within 1.5 meter and for at least 15 minutes with the person who has contracted COVID, 2 days prior to experiencing symptoms until 14 days. Those are the people that we will regard as close contact. However, we found in many cases whereby a person will say, I've been in contact of a contact. No, we don't entertain a contact of a contact. A contact is someone who was closed and not someone who was in contact with a contact. So the contacts, once they are contacted, we inform them of their exposure, and then we give them the necessary medical information. And we also advise them to keep on monitoring their symptoms, and should they fall sick, they should seek medical help and go for testing. And also instruct them to start quarantining with immediate effect, and provide them with a similar tool that we have provided for those that were COVID-19 positive. And so far, our strength with respect to how we respond to COVID within our institution, we have our internal COVID task team, which has worked so hard to develop protocols and guidelines for prevention and management of COVID, and also monitoring and reporting on COVID within the institution. We also have the support from Higher Health, which is a body that has been appointed by USAF to look at the health and wellness of students across the country. They are also responsible for developing some protocols and guidelines on behalf of higher health, of higher education institution. Also, we're receiving support from our district health services, because they provide us with resources, information, and also cater our staff and students at their facilities should they happen to need isolation facility. And also the availability of staff and professionals within the institution to assist us with resources to manage all these cases. However, we have gaps and challenges. Our challenges is the fact that reporting of cases is still a challenge, because some will opt not to report, especially those that test at the private facility. They will opt not to report, maybe due to fear of stigma, or some fear of being taken away from the residents to a government isolation facility, or as some have mentioned before, fear of just being limiting yourself from interacting with other people. It could be for that reasons that some opt not to report. And then staff and students will also report on campus whilst they know that they are symptomatic, or they know that they're still awaiting COVID test results, but they will still come and report on campus irrespective. And then again, identification of contacts is also a problem, because staff and students, they move around campus everywhere. So you find that a student has been in 3 areas or 3 classrooms at a time. And then now it means all the area is being affected by the fact that one of the person who has COVID has been there. And then again, one of the challenges is the fact that we don't have our own testing facilities. We don't have our own isolation and quarantine facilities. We rely on the government for now. And then lately we have learned that the Nazareth government quarantine facility has closed, but fortunately we engaged our 20 district health services, and they managed to make means for us to cater us at a hospital in Bronkhorstspruit and Odi. So our students will still be accommodated when they need isolation. Yeah, in closure, it's that our case manager allows for collection of critical information about the cases and those who have been exposed. And these are the contact details for anyone who needs more information. These are our very important hotlines and contact numbers that we will get more information from should we need. And thank you.
Well, thank you very much, Dr. Anna, for, I think it's great what the institution is doing, and other institutions could learn from that too. So I just wanted to find out, do you have support for caregivers then?
For now, the support that we have for caregivers is through our employee health and wellness, of which they are also undated due to the number of cases that they have to deal with and the little resources that they currently have. So I cannot say that it's a strength for now, but however, when a need arises, they will also outsource that we go to external service provider to get support there.
Okay, well, that's great. Do we have any comments? We're going to close in, so in 5 minutes. Do we have any comments? Yeah, I think there's just a yes. All right, go on. Thanks.
Okay, thanks. I've just written a comment on the chat, and I thought I'll probably just emphasize it as well. I think, in my view, we talk about quarantine, especially if you've been exposed, and if you are like caring for a sick person, and you have to get things done. And there's obviously advice that ask a friend to do it, ask a relative to do it. These are people who are also afraid of you. They are afraid of getting infected themselves. So for me, the most important thing is taking responsibility. The reason why we have all these measures, masking up, social distance, and sanitizing, is because they work. So even if you are going and you are very careful, of course, when you know you might be exposed, if you take responsibility, you are very careful. For me, the dangerous people, actually, like in my comment, are those ones who are asymptomatic, those ones who don't know, those ones who say, I don't have COVID. I think those are the drivers of COVID, more COVID infections, more than those ones who have actually been exposed and they think they might have it. They will take all precautions. But those ones who don't know are the ones who are actually driving the infection. That's just my view, Dr. Anna.
Yeah, thank you. I know, like
that's true, Dr. Katsande. Yes, we know that the infection is mostly spread by those that are asymptomatic. But however, we as health professionals, we cannot say we encourage people who are in quarantine or in isolation to be moving up and about. We are guided by the guidelines. Hence, ours is to promote the limit or to limit movement as much as possible and where possible.
Yes. Yeah. Okay.
Yeah. So sorry if I can just come in. It's something that I've always been talking about. I think one of the gaps since COVID started with the Department of Health was the information dissemination, especially on media, public media, outlets like your news, your radio, your TV. It's only now that this information, and it's not even being well disseminated. So that is the challenge. And the Department of Health talks more about quarantine, more than it talks more about mask and getting this information to the general public who think they are not infected. And that is the flaw of what the department, I think it's a very, very critical shortcoming of how we have managed COVID in South Africa. Thank you.
Yes,
thank you. And
I think it's something that we can take up when we have our engagement with the Department of Health, that it's one of the gaps that have been identified and it needs to be addressed.
Thank you. So maybe if you can just unshare and then we will conclude. Doc. Yeah. All right. Well, but thank you very much to all my speakers. So I know that, we've been chasing time, but I think that it was well worth having this session and giving the time. As you know, as I've said, we record these, so we will edit them and put them up. So I'd like to thank Professor Nyazema, Ingrid, Busiso, Dr. Charles, Dr. Anna. And then, of course, I'd like to thank all of you who were with us, for close to 2 hours. We might have another session because, as you know, survival is a matter of time. So we would like to, we're thankful that, we have survived this far, but maybe in a few more months, we can have another session to also share this information. And to end, I think I'd just like to end on a hopeful note and read this by Helen Steiner Rice. There's no night without a dawning, no winter without a spring. And beyond the dark horizon, our hearts will once more sing. For those who leave us for a while, have only gone away out of a restless, careworn world into a brighter day, not just for them, but also for us. So with that, I would like to thank all of you and hope that we will meet again in 2 weeks' time. So be safe and sharp.
Thank
you.
you.
Bye.
Thank you.